Hello and welcome. Thanks for joining me today for a Medicare neighborhood meeting. Let's start with who we are and what we do. People across America trust Wellcare for coverage that goes beyond basic Medicare. Medicare Advantage plans from Wellcare support your total well-being and help you live a better, healthier life. Like original Medicare, we offer doctor and hospital coverage. But you'll find our plans may include extra benefits to take care of all aspects of your health. Prescription drug coverage, dental, hearing, and fitness. Our Medicare Advantage plans are affordable, with predictable costs, low deductibles and co-pays, and limits on out-of-pocket spending. We cover traditional healthcare services, plus we can connect you to resources that address other needs. From smoking cessation and help managing prescriptions to social resources that help with nutrition and transportation. Today, you'll learn about the basics of Medicare, the advantages of Medicare Advantage, and why Wellcare may be the right choice for you. Selecting a Medicare plan can be complicated, but we're here to help. This easy-to-follow video explains Medicare in simple language. It covers everything you need to make a good decision about your Medicare coverage and enroll in a plan. It also explains how a Wellcare Medicare Advantage plan goes beyond the basics so you can live a better, healthier life. Let's start with the basics. What is Medicare? Medicare is a program administered and regulated by the Centers for Medicare and Medicaid Services, CMS. You are eligible for Medicare if you are a citizen or permanent resident of the United States, age 65 or older, under 65 with certain disabilities, any age with end-stage renal disease, ESRD, or amyotrophic lateral sclerosis, ALS, also called Lou Gehrig's disease. This video will help you understand original Medicare and how it compares to Wellcare Medicare Advantage plans. Let's go over the 4 different parts of Medicare. Part A covers inpatient care, a skilled nursing facility, hospice, and some home health care. Part B helps with the costs of doctor visits, outpatient services, and some preventive services. With Part B, there are additional costs, such as a monthly premium. Parts A and B together are called Original Medicare. Part D helps to cover the cost of prescription drugs. To receive drug coverage, you have to purchase a prescription drug plan to add to your Original Medicare or enroll in a Medicare Advantage plan with Part D prescription drug coverage. Part C is Medicare Advantage. When you join a Medicare Advantage plan, you get Part A, Part B, and usually Part D coverage to support your total health in one plan. Many of these plans offer extras not found in Original Medicare, such as dental, vision, hearing, and gym memberships. Wellcare offers different kinds of Medicare Advantage plans, like Health Maintenance Organization, HMO, Preferred Provider Organization, PPO, Private Fee for Service, PFFS, Dual Eligible Special Needs Plans, DSNP, and Chronic Special Needs Plans, CSNP. Other types of plans may be available to you. Ask your licensed representative for details. Now let's see how a Medicare Advantage plan compares to Original Medicare. Basic Original Medicare is just a starting point that covers doctor visits and hospital stays. Usually, you pay a monthly Part B premium and must meet yearly deductibles. Original Medicare will then cover 80% of the approved amount, and you're responsible for the remaining 20%. There's also no limit to your out-of-pocket costs each year. Wellcare Medicare Advantage plans support your entire well-being so you can live a better, healthier life. In one package, many of our plans give you Part A and Part B coverage, plus dental, vision, hearing, wellness, and fitness programs. Many of our plans also include Part D prescription drug coverage. Medicare Advantage plans also help you control costs in the following ways. Many of our plans have no additional premium. Primary care visits and many prescription drugs have $0 or low copays, and Medicare Advantage plans have a cap to your yearly out-of-pocket expenses. If you reach the maximum out-of-pocket amount, you pay nothing for your covered in-network services for the rest of the calendar year. Now let's talk about Part D. Medicare Part D is coverage for prescription drugs. You don't automatically get this coverage when you become eligible for Medicare. Yet, many Americans rely on prescription drugs to maintain their health and well-being. It's important to consider whether you need a plan with prescription drug coverage. To receive drug coverage, you can join a Wellcare Medicare Advantage plan that includes prescription drug coverage or standalone prescription drug plan. Medicare Part D covers brand name and generic prescription drugs. You generally pay less or nothing at all for generic drugs. A formulary lists the drugs your plan covers. Medicare Part D has 4 cost-sharing stages, and the amount you pay to fill your prescription drugs depends on which of the 4 payment stages you're in. Deductible. This is the amount you pay before a plan covers your prescription drug costs. Some Wellcare plans have no deductible. Initial coverage. During this stage, the plan pays its share of the cost and you pay your share. You're in this stage until your payments and the plan's payments total $4,430 for the year. Coverage gap. When your drug costs and plan payments for the year reach $4,430, you enter the coverage gap stage, commonly known as the donut hole. You will pay 25% of the cost for formulary generic and brand name drugs. You will stay in this stage until your out-of-pocket costs for the year reach $7,050. Catastrophic coverage. After your out-of-pocket costs for prescription drugs reach $7,050, the plan will pay most of your drug costs for the rest of the year. You will pay either 5% of the cost of the drug or a copay of $3.95 for generic drugs or $9.85 for all other drugs. Find out if you qualify for Extra Help. Extra Help is a Medicare program that helps people who have limited income and resources pay Medicare prescription drug program costs, like premiums, deductibles, and co-payments. Depending on your income and resources, you may qualify for Extra Help. To find out if you qualify, simply call the Social Security Administration at 1-800-772-1213, Monday through Friday, 8 a.m. to 7 p.m., or visit ssa.gov. Now let's take a look at all the extra benefits you'll receive at no extra cost. Many of our plans feature big savings on prescriptions delivered right to your door, dental coverage that goes well beyond original Medicare, Flex Card to help cover additional dental, vision, or hearing costs, vision coverage that may include a yearly exam, and a fitness membership for a leaner, healthier you. If this sounds good, it will sound even better with hearing coverage and more, like allowance to buy over-the-counter items, transportation to doctors and pharmacies, an easy-to-use convenient mobile app, and a nurse advice line available 24 hours a day at no cost. When you choose a Wellcare Medicare Advantage plan, you can keep your health and well-being in balance. We partner with the leading medical providers, specialists, hospitals, and pharmacies in your area. Many of our plans have $0 or low premiums, $0 or low deductibles, and $0 or low copays. Most plans cover many preventive care services at no cost to you. Now let's talk dates. Take advantage of your enrollment window. Initial coverage election period. This is the time when someone first becomes eligible and can sign up for Medicare. For most people, it begins 3 months before the 65th birthday month and lasts 3 months after the 65th birthday month. Annual Enrollment Period. The annual enrollment period for 2022 starts on October 15, 2021, and ends on December 7, 2021. During this period, you can enroll in a Medicare Advantage plan from Original Medicare, enroll from one Medicare Advantage plan to another, or enroll in Original Medicare from a Medicare Advantage plan. Medicare Advantage Open Enrollment Period. The Medicare Advantage Open Enrollment Period starts January 1st and ends on March 31st. During this period, you can enroll from one Medicare Advantage plan to another, enroll from a Medicare Advantage plan to Original Medicare with or without a standalone Part D plan, but not from Original Medicare to a Medicare Advantage plan. Or individuals may add or drop Part D coverage. Special enrollment periods. You could qualify for a special enrollment period during any month when certain events happen in your life, even if it's outside of annual and open enrollment. You may qualify for one of them if you move, you are eligible for Medicaid, you qualify for extra help with Medicare prescription drug costs, you move to an institution like a skilled nursing facility or long-term care hospital, or you want to switch to a plan with a 5-star overall quality rating. Be sure to sign up when you're eligible. If you don't, you might owe a penalty. Ready to sign up? We make it easy. You can enroll by meeting with your licensed representative, visiting us online at wellcarenow.com, or by calling 1-877-MY-WELLCARE, TTY 711, 8 a.m. to 8 p.m. 7 days a week. After you've completed your enrollment application, you'll receive important information and materials about your new plan, including your ID card, member welcome kit, and welcome call. Thank you. Please tell your friends and family about your decision and the reasons why you have selected Wellcare as your Medicare Advantage health plan.